Hello. In this, let us look at this tablet SINAREST. So let's look at this composition. So this is paracetamol, phenylephrine, and chlorpheniramine, right? So a wonderful combination, I would say. See, if you have cold, right? Common cold, this will help a lot. Okay, so it is a one-stop solution, I would say. It has no antibiotic. You also get this in syrup. Let me show you the syrup. Hold on. Yeah, so this is the syrup counterpart. It has per 5 ml, if you compare, this has a little lesser quantity of all this. But this I'm keeping it away in the side. Okay, see, this is green SINAREST. There are so many SINAREST and they confuse you guys. So let's talk about the green SINAREST in this. I don't know why so many names and okay. So this blue one is actually SINAREST plus, they are saying. We're talking about the plain SINAREST green one, guys. Plain SINAREST new also they have put off here. Okay. Let us look at this composition now. Paracetamol, how much? 500 mg, more than enough, guys. 500 mg for an adult. 500 mg is more than enough. And phenylephrine is 10 mg. And chlorpheniramine is 2 mg. You can take this thrice a day, guys. Thrice a day you can take this. Keep it in your bag at all times, you know. For any issue, you can take this almost. Okay. And now let us look at its classification, guys. Okay. Yes, in classification. So first let us look at paracetamol, right? Paracetamol is what? It is nothing but acetaminophen. And you should be able to give 500 is enough. 500 mg. If I don't specify, it is fine. If I don't specify mg, it means it's mg only. 500 means 500 mg. So it is a antipyretic. It will reduce fever and reduce pain also, but it will not reduce any inflammation, remember. And it is a in US and all, you will get it in the name of Tylenol. Okay, what is it? It is a acetaminophen. So it is coming under analgesic antipyretic with poor anti-inflammatory action. Okay. Okay, so phenylephrine is here, guys. Phenylephrine, we told you how much? 10, right? 10 means 10 mg. And this will be there in many cough syrups also. It is a vasoconstrictor, hence it will do nasal decongestion. It is a sympathomimetic, adrenergic drug it is. So if you are taking this, you will have that little tachycardia, is it? Sympathomimetic it is. Okay. So it is a vasoconstrictor, nasal decongestant, phenylephrine. Are we good now? Let's move on. Okay, so in antihistaminics, look at this. Antihistaminics, that is H1 antagonist. You have here under first generation, mildly sedative. Okay, it is not moderately or heavily sedative. It's mildly sedative. That is chlorpheniramine. We are giving how much? 2 mg in that SINAREST tablet, chlorpheniramine. Okay, it is mildly sedative, antihistaminic. That is what? It is anti-allergic type. Even in cough drugs it should come. Let us look at cough drugs. Okay, in drugs for cough, look at this. You have antitussive. Yeah, cough center suppressant. It is a centrally acting. So in the brain itself, it will suppress the cough. That is chlorpheniramine, antihistaminic. Okay. Antitussive, cough center suppressant, drugs for cough. So this is a very useful combination, I feel. So whenever they say that you should not give brand names, but I would still recommend this combination. In any brand should be fine. Okay, so this is from which brand, guys? Some Centaur brand it is. It's pretty expensive according to me. 120 for 15 tablets. I feel it is expensive for the kind of drugs in it. Paracetamol is very cheap. Chlorpheniramine also is very cheap. Phenylephrine also is very cheap. Why should this combination be so expensive? Okay. Okay. Now let's look at the tablet. There's a tablet here. Looks like you can break it in half. Okay, there is something written here. So such a nice tablet. Now let us break it and taste it. It tastes bitter, not that bitter also, kind of okay. Okay, so let us look at the side effects of this. Okay, so paracetamol overdose side effects, liver failure, and otherwise phenylephrine is what? Sympathomimetic, right? So it will cause tachycardia, tremors, palpitations, all that kind of sympathetic effects, right? Overstimulate, over anxiety type of effects. Chlorpheniramine is antihistamine. It's a cough suppressant. What else? What can it cause as a side effect? It's going to make you feel a little drowsy. Okay. So guys, side effect wise, let's look at the side effects of phenylephrine. Phenylephrine is vasoconstrictor. So what happens if it is a vasoconstrictor? So what will happen? Your blood pressure will increase. Phenylephrine also, because it constricts the vessels, if they are saying in pregnancy first trimester, it may not be safe to prescribe this phenylephrine. Okay. Then coming to chlorpheniramine. Chlorpheniramine is antihistamine. It works on the brain, right? It is a antitussive, cough suppressant. So what they are saying is chlorpheniramine is a mild sedative also. So it may cause drowsiness a little. Okay, what else would you like to know about this drug, SINAREST? There are a lot of other cheaper alternatives. Looks like Febrex plus, I think, Vicoril. All those are very similar composition, guys. Anyways, in this video we have covered SINAREST. Okay, thank you. Bye bye.